Hey, what's up? I'm from the Bronx, so you gotta excuse. Sometimes the little hood comes out in me when I speak. I'm not your typical professor. I actually like to rap through my presentations, but I won't. I'll spare y'all today. Um, but thank you so much, Mama Bug, and Rose, and all of you for being here. It's an honor. I am usually in spaces with a lot of people that don't look like me, being the 5% in our country. It's a struggle every single day to be in academia, and sometimes I want to leave, but I know how important the work that those of us that look like us that are in there and the contributions that we're making is important. So today, the objectives are to understand the importance of community-engaged research in maternal mental health and describe some strategies that we did in Atlanta that you can probably replicate in your states. But before I get started, I'm sure a lot of you didn't know that we had a Center for Maternal Health Equity at Morehouse School of Medicine because HBCUs have been left out of the Black maternal health picture. But finally, someone thought to invest in one, and it happened to be our state, through a governor that, I won't mention too much about, but we were ecstatic to be able to receive some seed funding due to the inequities that existed in maternal mortality rates. Georgia still has one of the highest maternal mortality rates in the country, and we're seeing the inequities not just increase in African American populations, but also in Latinx populations in our state. Our mission and vision is to pursue equity in maternal health by reducing maternal morbidity and mortality, and we take a life course approach, and so we have projects focused on sexual and reproductive health equity, fertility, and others all through the postpartum period. We do our work in 3 different ways. We do translational research. We are a medical school, so we have people that are using community-engaged approaches in basic science all the way to population health. We do a lot with the community. We like to serve and provide technical assistance and capacity building to Black-led community-based organizations, and use the research to inform policy. And I'll talk a little bit of how we did that with this project. And then we also do a lot of team-based training, and so trying to build up and diversify the maternal health workforce. So I want to start with my why and my positionality. Like I mentioned, I'm from the South Bronx. I witnessed people in my family die prematurely that didn't have to. I witnessed rates and my friends in middle school getting pregnant, not by choice. And so a lot of inequities and experiences with a broken healthcare delivery system. And my why is also the fact that I witnessed a lot of women in my family go through depression prior to pregnancy, and it be exacerbated during pregnancy and after pregnancy. And I was one of them as well. So this is something that's very personal to me, and something that I wanted to address. And everyone's like, well, you're not a behavioral health person, or you're not a psychiatrist or a psychologist. Why did you go into this work? Or this project. And I was like, well, it was personal, but it was personal to the communities that I serve and work with. And this was a priority issue, and we wanted to make sure that we were addressing something that wasn't top down, but that came from the community. So what we went into a little bit more was what was happening during pregnancy, because at the time, which was 2016 or 2015, can't quite remember because it's been such a long journey, was that no one was really talking about perinatal mood and anxiety disorders, and we knew that this was common, right? This is the most common mental health condition that occurs among women. And then we know that there are inequities, that Black women experience a higher prevalence of maternal mental health conditions, and particularly postpartum depression, and that they're screened at lower rates. And even the screening tools that exist don't account for the cultural nuances that Black women experience and how they experience mental health. And that a lot of women are not receiving the treatment that they need in culturally relevant ways and in using traditional healing practices. And so again, this was something that we wanted to explore. We also heard a lot from Dr. Monica McLemore, Joya, Ken, about these contributors to maternal health inequities, that they are centered around systemic racism, unemployment, exposure to violence, gaps in medical insurance, adverse childhood experiences, lack of access to high quality medical care and mental health care. And it contributes a lot to to childbirth and complications that women experience. Globally, maternal mental health conditions are the leading contributor of death of pregnant and birthing populations. So we decided to take some seed funding because when you're a woman of color in academia, they only want to give you this much money to save the whole entire world. And so we took a small pilot federal flow-through grant and partnered with the Center for Black Women's Wellness, which is a respected organization in Atlanta, to really understand what was going on. Because we knew that there wasn't a place that women who were experiencing maternal mental health conditions to go to. So we were like, well, why are we trying to complicate the process? Let's meet women where they're already accessing services. And so we wanted to explore how do we integrate perinatal mental health services in community-based settings. With traditional research, we knew that there was a lot of distrust, that there are ineffective interventions because a lot of them are individually focused. And so we wanted to take what, again, people coin as community-based participatory research that we know our communities have been doing forever, right? Community organizing, civil rights movement, just we always were about our village, and use these methodologies to really explore the issue. But we wanted to take an equitable partnership approach. And so for this pilot grant, I wasn't just a PI, but my colleagues at the Center for Black Women's Wellness were also the PIs of this project. The other thing that we saw was that in mental health services, a lot of the research was very much top-down. And so, and that mental health services typically left out the voice of the community. And so we wanted to use methodologies that were really centering the lived experiences of our communities, recognizing that people's voices are legitimate sources of data, that community experience is expertise, and really lift up those assets that already existed within the community. So this is our setting. I always like to present the context of where we're at. The Center for Black Women's Wellness is located in Southwest Atlanta. They're about a 5-minute drive from Morehouse School of Medicine, but if I took our public transportation, it would take me an hour and a half to get to that organization. Where it's located again in Southwest Atlanta. It's a largely African American population, about 88%, and the median income in that community is only $24,000 a year. It has one of the highest unemployment rates and a 40% poverty rate, and it's ranked on the lowest of a constellation of neighborhood health and quality of life factors compared to the rest of Atlanta. Ken and others talked about redlining, and between 5 miles from where Center for Black Women's Wellness is and another part of Atlanta, the life expectancy is about a 12 years difference. But one thing I want to highlight is that in South Atlanta, these are neighborhoods that have resilience, although we're tired of that word, right? We're tired of being resilient because things need to happen for our communities. But they have amazing organizations that exist that come together and use the limited resources that they have and give 110% to the people that they serve in that community. So the purpose of this project was to really assess the mental and emotional health challenges of underserved women, of minoritized women, or women who have been placed at risk, right? Because we're talking about systemic racism. And then to examine the priorities of the community. So rather than us figuring out solutions, as I mentioned, the community has the answers, learning from the community what we can do and how we can work together. So the Center for Black Women's Wellness has a Healthy Start program, and a lot of the Healthy Start programs have these coalitions called community action networks. And this is where we thought would be the best sort of partnership, is to work with all of these organizations to really address the issues related to maternal mental health. And they had already decided as a community action network that they wanted to prioritize maternal mental health. So it was just like this perfect marriage of coming together to be able to work on this. And the primary focus of community action networks is about cross-sector collaboration to reduce inequities within the community. So we used a collective impact approach to really examine how we work together. The common agenda was maternal mental health. We established different work groups to think about the measures and how we wanted to come at this issue within our communities. And together, Morehouse School of Medicine and CBWW provided that backbone support for this project. But the Center for Black Women's Wellness provides the backbone support of the CAN throughout its existence. And we had over 200 community members representing those cross sectors come together to work on this issue. But prior to that, we knew that we wanted our partnership to actually be engaged in conducting the research as well. And so we worked with our family support specialists and others at CBWW and others that were involved within the CBPR partnership to learn how to actually conduct research. And so we use a multiple intelligences framework, thinking about your 5 senses and how to have experiential learning to understand how to actually conduct research in meaningful ways that can create trust within the communities. And so we had didactics, we had media, we had math, music, hypothetical scenarios, role-playing, and then ensuring that people understood the ethics of conducting research. We also had to get consent from the community. That was really important for us in order to conduct research because we knew that there was so much distrust. When we came into the community, people, because there are other 4 major academic institutions located in Atlanta, and they're like, y'all can't come here and do some, drive-by research and expect us to be able to trust you, because we've seen all the research that's been done and nothing's changed our communities. So what makes you different? And so that took a while to build that trust and relationships with the community. And to ensure them that we were going to do things right this time and always share and be transparent in our processes and how we worked and engaged with our community. And so a big part of that was not just them seeing us with our PhDs and higher education, but seeing others that look like them and training those that were interested in working on this project together to conduct the research. And so we took a mixed methods approach where we had face-to-face interviews with Black women, with healthcare professionals, and community outreach workers. And our interview guide was really informed by the community. As an academician, you want to know the world. And so when I first thought about the survey, I was like, yeah, we're going to do this and we're going to do that. And they were like, no, Dr. Natalie, because they don't call me Dr. Hernandez. They call me Dr. Natalie. No, Dr. Natalie, you don't know what you're talking about. This needs to be like 3 pages and only take 5 minutes. I was like, what? What kind of data can you get in 5 minutes? But you'll see what we were able to get. And then the qualitative component, being, again, centering those lived experiences and amplifying the voices, right? Because we know that our community has power. We're not here to empower them. We're here to activate the power that communities already have and providing them with the tools and the resources to be able to do that. And then within the analysis, particularly for the qualitative, we did a thematic analysis. The interviews were mostly conducted in the community at the Dunbar Center. We went to libraries, we went to community baby showers. We were on the street sometimes, just talking to some moms when they dropped off their children at Dunbar Elementary School. And we wanted to ensure that they felt comfortable and that they were ready to engage with us. The research, again, was reviewed and discussed. We even created, using infographics, information to help them understand. And so if some of you have ever conducted research, these informed consent forms are ridiculous. They're supposed to be ethical, but they're like 10 pages. You're describing all of this information. And so we created infographics so they know, like this is a permission slip. And you have every right to interrogate us as researchers to say whether or not you want to participate. And we do this because of you know the injustices that occurred in the community. So bring it in a way that was meaningful to them and that they understood. And then being able to track a lot of our processes, because we wanted to ensure that if people were interested in replicating this study, that we had documented all the steps on how to do this. And so with the interviews, we saw for the women, we didn't collect a lot of data because we knew that there was so much mistrust, and a lot of you mentioned, in conversations, they're going to be like, well, why are you collecting all of this data about me? What are you going to use this data for? And so we just wanted to know what their age was. That was the only information that we collected from the women. But from the outreach workers and the healthcare providers, we did collect some demographic information. So with the families, we interviewed family support workers, and these are people that are in the community working with these women every single day, and who was actually the ones that highlighted the needs, the mental health needs of our community. And they mentioned, like we all know, the lack of resources that exist. People are like, we care about mommies and babies, but then when it actually comes to it, there's nothing that exists for our communities. Now, in Buckhead and all these other places in Atlanta, there are a lot of resources, but not in Southwest Atlanta. And so we wanted to, that was something that continued to come out. Then, the family support workers talked about a lack of this support system that existed for the women that they serve. Even them having access to resources, they just didn't have enough to continue to provide to the Black birthing persons because there was nothing that existed at the time. I mean, now people are talking about maternal mental health, but at that time, no one was really talking about it. And then we knew that, the community was self-medicating. They didn't have access to, things that they could if they went to a medical visit. And so they were self-medicating with cigarettes, with a joint, with different things just to help them forget about the stressors that they're experiencing. And a lot of them were displaced. They came from homes where, we experienced a lot of trauma. I understood where they came from because I came from that community. It was just up north. And so there was, that was something that, again, was a common thing. And then there was this stigma about going to see someone. A lot of they mentioned that the women just didn't want to do that because they were afraid that they would be labeled crazy. We don't air our dirty laundry out there. Or, as we heard from Ken, that their children would be taken away if they reported that they had some type of maternal mental health condition. Because we're quick to criminalize Black women for conditions like that. And then again, this distrust and fear of judgment, because we still care about how other people feel about us in our communities. We're a close, tight-knit community, so rumors happen, and they were afraid of that. And then, as I mentioned, the fear of the child being removed from the homes. Did that come up? Okay. So they don't trust very well in the people that they're receiving services from. These are quotes from the family support workers, because they don't look like them. They feel like they're being judged, maybe by the questions that are being asked. They may not like where it's being held. It's not familiar grounds. It's not that they don't feel safe, they just feel out of place. If a woman from the community had to seek out mental health services in Southwest Atlanta, she had to drive about 40 miles to receive the services. You have to understand that when you are displaced and you can work for whatever reason, lack of education and just various things, it takes a real toll on your mental capacity. They understood, these women were juggling so many things in their lives, as well as, just that fear and that constant judgment of who they were. And it really did take a toll. This is heavy work, and I know that the family support workers go through a lot as well. With the women, they felt that no one cared about them. When we did the research, they were like, you're the first person that ever asked me how I felt about anything. The first person. And they were so fearful of doing the research. They never participated. They didn't, it took a while sometimes to get through the questions because no one's ever asked them for their opinion, so they didn't know how to respond, and they thought it was like a test when I was asking them because they never had participated in research before, and so they were like, I don't know what to say. And then once they got comfortable, then they started just opening themselves up. But, a lot of them said they were depressed. They were like, I don't know what depression feels like. I think that that's what might be happening to me. And they expressed it in, my stomach's always hurting, I can't sleep. I just can't stand anybody right now. I want to run away. I don't want to be here, one woman told me. I don't want to be here. That there were insecurities with being a mom. They didn't know if they were doing it right, if they were failing their children. They didn't want their children to go through what they went through growing up in that community. And that the doctors were not listening to their concerns, we've seen everyone wearing the shirts, listen to Black moms. No one's listening to them, again, over and over and over again. And the lack of diversity, again, they didn't want to open up to people who didn't look like them because there was so much of that distrust, and no one asking about their mental health. So one of the quotes is, because they don't be caring to me, they just don't care. So it's like, why waste your breath if they ain't going to do anything about it? And the other one is, I kept telling them it hurts. It felt like I was just being torn apart. After they got her out, I felt everything afterwards. This was a birthing person who told me when she was giving birth, she told them that she was feeling them giving her the C-section, that her anesthesia was wearing out. And they told her, don't worry, it's going to just take 2 more minutes and we're going to get you out of here. She was crying the whole time I interviewed her because that caused the trauma that was leading to her depression that she was experiencing. And she just didn't know what to do about it. And we actually sat together and created a case and spoke to a lawyer about what she had experienced. Because again, I'm here to serve my community. I'm not just going to report on it and not do anything about it. And then I had the pleasure of talking to physicians. And they were concerned too, because a lot of them just didn't know how to do screening. They felt like it wasn't their role to do mental health screening. They didn't know how to do it. They didn't know what were the next steps on doing maternal mental health screenings. And then they pointed out a lot of the issues that thankfully we don't have anymore. And so at the time, there was no postpartum care after 6 weeks. That women or birthing persons that they experience having maternal mental health conditions, they knew had it prior to pregnancy. That there was a lack of funding to be able to do anything about it. And again, that the tools that they had, they just felt like it wasn't really capturing Black women's experiences. And then one even talked about their own experience. I want to get better. I want to be a better mom. They're very resilient in that. I don't know how I know. I want it to be better. I just don't know how. So even within healthcare providers that look like the community, they were even experiencing a lot of mental health concerns as well. So overall, the themes were around the lack of support, the structural determinants that kept coming up, the fact that issues weren't being addressed, and so we knew they needed to be addressed right away, developing tools that were culturally relevant and sensitive to the needs and the wants of our communities, and the fact that if they reported anything that there would be these repercussions. So then we did a survey with the community, and we did a lot of recruitment through word of mouth because we knew that that's what really worked in our community. We worked with 5 primary recruitment sites, which were all Black-led, community-based organizations that served Black birthing persons. And we did this in just a couple of months. We actually got 465 surveys in 2 months. But because of literacy levels and just time, a lot of them were completed, so we had a lot of missing data, so we really could only do an analysis with 302. But that shows how interested they were to participate in this research project. These are just pictures of flyers and how we went about going into the community. We knew that we always had to give something back to them, and so we tried to do a lot with baby showers, and then these were ironically like cleaning kits that we gave, and I think the pandemic happened just a couple of months later, and we gave them Clorox and a whole bunch of stuff. This is again another example of one of the events that we did where we actually distributed the survey and gave out car seats and worked with, again, other nonprofits that were just doing amazing work for birthing populations. The mean age of the women were really young. We have one of the highest teen pregnancy rates in the country in Georgia. The stereotypes are that women don't have education, and we knew that 55% had higher than a high school education. And the numbers are a little misleading because it says 80% were insured, but for the most part, they were insured because they were pregnant, and so they had Medicaid. And then the 77% had a regular health care provider, again, because they had Medicaid. One thing that we found was, our partners were really interested in adverse childhood experiences. And we found that, almost 50% reported some type of emotional abuse that they had experienced. That was the most frequently reported ACEs, followed by living with someone who used illicit drugs or was a problem drinker. We actually think the numbers are higher because we use the standard ACEs, but we know that there's a new ACEs that a group out of Philadelphia created that's culturally sensitive and captures more of these experiences. And we know a lot of this is due to that historical trauma that Ken Harris talked about before. One thing that was really striking to us was that nationally, only 39% of Black women report having experienced perinatal mood and anxiety disorders, but 56% of that sample that we surveyed was experiencing perinatal mood and anxiety disorders. And that was really, that hit us really hard, but it verified what our family support workers were telling us. So how are we using data, right? You just can't collect data and then share it in the ivory tower and not do something about it. And so we knew we had to use the research to inform policy. And this is at the Mother House in Atlanta, which is the birth of the Black reproductive justice movement. And so we knew we had to do local systems change. And we dispersed ourselves to be a part and be at the table at almost every single organization that we possibly can to ensure that we were bringing up maternal mental health. And so the outcomes of that was, we used this data. There was now more of an interest in Black maternal mental health. We actually got a proclamation through the state to acknowledge what was happening around it. There were more investments in maternal mental health, and so finally that year they created the Peace for Moms, which is a referral service that connects Georgia's healthcare professionals to licensed psychologists and psychiatrists to be able to provide care. Now a lot of our community-based organizations like CBWW do a lot of mental health support and through peers, because one of the things that Black birthing persons had acknowledged to us is that they wanted it in a group setting. They didn't want this individualized one-on-one. And then last year we were recognized for the Innovators of the Movement Award because other organizations started trying to co-opt the things that we had started and finally gave us our recognition for the work that we are doing. So what can you do? Be compassionate. This is tough work, and these populations are going through a lot. We mentioned listening to Black moms. This was a study we did. We got so much data and we did so much with it, and it was a $10,000 study. That was all. And when you talk about, how much it costs to do incentives and do some things, that money was gone really quickly, because we want to make sure we incentivize our participants as well. Ensure that screening is happening and that it's happening consistently, and training and equipping providers to be able to provide maternal mental health services. We know that we need to diversify the mental health workforce, just provide, loan repayments or programs that can entice people to go into this field. It's a heavy and traumatizing field in itself, but we need more of you to be interested in this. Policy is the only way we can really create systems change. Like, we have to be invested in advocacy and policy, and so we've been creating scripts and things to start informing legislators on why they need to make these investments, particularly with the Momnibus Act. Then participate in Awareness Week. There are amazing organizations, national organizations like Shades of Blue, that started Black Maternal Mental Health Week, and so support those types of initiatives. Connect with different types of stakeholder groups. It's going to take a diversified and multi-sector group to really address this issue. And lastly, invest and support Black-led, community-based organizations. They're already doing this work. You don't need to reinvent the wheel. Work with them, support them, give them the actual funds that they need, not the crumbs that they usually get to do this important work. And this is just a snippet of the organizations that exist that are doing just such great things across the country. And lastly, I want to thank the family support workers, and I'm going to get emotional, from Center for Black Women's Wellness, who have been in this fight for such a long time. Can y'all stand up, please? I chose this quote: "A woman who walks in purpose doesn't have to chase people or opportunities. Her light causes people and opportunities to pursue her." And that's exactly who they are. These women, the phrase, "it takes a village," certainly applied to them and this project. They are folks bonded by attitudes, values, and goals. They go out of their way to ensure their communities are taken care of. I saw their collective wisdom. They gave us motivation. They make me a better person each and every single day that I get to engage with them, and I love them so much. And I just want them to know that there's some days those big goals seem impossible, but y'all make it so possible. And I just thank you for everything that you do in serving our communities. So I want to say thank you. I don't want to keep boring you, but we did publish 5 papers in which all of them are co-authors on as well, and presented last year, Black Mamas Matters Alliance and other conferences, and Ms. Katrina just presented recently as well with the Maternal Health Learning Innovation Center on the project. And so, it's teamwork, and I just thank them. So thank you so much.